I chose UH because there are a multitude of different specialties and opportunities for different areas of expertise like oncology, critical care, and transplant, so I can be able to get experience in those multitude of areas.
My favorite thing about this program is our approach to teaching the residents. We support them in their quest of learning. We support them in their quest of finding a job at the end of this experience. We help them be better people and also better practitioners.
We have 3 residencies at Cleveland Medical Center: our PGY1 pharmacy program, our PGY2 critical care residency, and then our PGY2 medication use, safety, and policy residency. I think UH has a lot to offer. I think that any resident that comes here will be able to make an impact in patient safety.
So the PGY1 program, the resident gets to experience all different aspects of pharmacy, from operations side to various clinical rotations, including intensive care, transplant, oncology, medication safety, as well as some administrative aspects of pharmaceutical care.
We are going to have 2 rotations in medication safety and 2 in drug information and policy.
Critical care includes up to 10 possible ICU experiences, including medical ICU, and right now COVID ICU, CICU, heart failure ICU, neurosciences ICU, surgical, CT, trauma, pediatric ICU, and neonatal ICU.
This program has a lot of opportunities to individualize. I think that's important just because everyone has different interests, everyone has different goals. So I'm able to tailor my experience to things that I want to do. For this program, you're able to choose a mentor among the clinical specialists. So I've chosen a mentor, and she's given me great advice for both clinical and career paths. Really, all of the specialists here give great advice.
I think one of the keys of our residency programs is the residents really get to customize and work closely with very experienced preceptors and see a variety of high acuity patients during their training. Residents can take advantage of plenty of opportunities to teach the next generation and also teach experienced and seasoned providers across the spectrum of care within the organization.
Being able to work with the attending physicians, the medical residents, the nurses, the respiratory therapists, I think it's been great for me from a learning standpoint, as they've been able to teach me about different things that I may not have known from a pharmacy perspective. And then they're always very collaborative and looking for pharmacy's input. And so whenever there's a medical decision being made, I have seen the team really reach out to me and any other pharmacists that were part of the team and really take our input into account.
One of the things that I really appreciate, not only in my practice but also in training residents, is when you see what the providers ask, what do you want to do for this patient, or what do you think about this aspect? So when they ask that of either myself, my colleagues, or our residents in training, they really value our input on making sure that the optimal care in a safe fashion is done for those patients. We ensure that the resident is progressing as they need to through the program, and there's no surprises. We know exactly what's going on. We can try to assist if needed, if there's any additional research support, if there's any clinical support they need, if there's any mentorship support, if there's any support as far as work-life balance. So I think that is very helpful for the resident in their progression and successful completion of the program.
For any student or resident who is looking into getting a PGY1 or PGY2 residency, I think it's important to see what your goals are and see whether the program is going to fit your goals or not. Coming into residency, I expected to be able to learn a vast amount of knowledge, but I didn't realize how much I would truly know about all the different medications and disease states. I never would have imagined that I would be able to manage patients to the level that I do today, and able to continue to keep learning through the help of our preceptors and our different interdisciplinary teams.
There are a lot of different programs, they all offer different things, but ultimately it's going to be your colleagues that help you get through the process and that teach you. So if you get along with the people here, then your time here will be a great time and you'll learn a lot.